Hello, how's everybody doing today? Today is a great day because we're actually back into another bioplastic surgery live, and we're gonna be speaking about bariatric surgery. Yeah. So what we're gonna be doing today is that we're gonna be speaking wisely. What's the best thing that you can do, and what's the best thing you can do in case you experience any, for example, any weight problem. So we're gonna be speaking weight. We're gonna be speaking about the weight, and we're gonna be basically discuss each other what's the best thing you can do. Well, hello, Princess. Remember Princess Diana Solano? She's opening an spa that is called La Detox LA. So what he's going to basically doing is that everything is gonna be organic. So right now, I'm trying to live the most organic lifestyle possible. I'm trying to build, of course, better of the version of myself. So actually doing it in a spa that everything is gonna be organic is kind of awesome. So if you have any questions regarding plastic surgery, please let me know. But we're gonna be speaking about bariatric surgery. So bariatric surgery is something when you need it, and when you need it, you know it. And that's for some kind of people that actually has gone through a specific kind of journey. So we're gonna go through it. So there is patients, right, that do experience a little bit of weight problems, and they're actually managing to actually take care of themselves. For example, let's say that there is a lot of inspirational stories about people actually just losing weight by their own. Let's say that we start from around 200 pounds. So we start from 200 pounds, and we actually going to calculate maybe we are 5'5". So we're 5'5", right? And we are actually calculating the BMI is going to be a 33. So we're 200, and we're actually 5 pounds. I mean 5 feet 5 tall. Then we are actually experiencing an obesity stage 1, right? Obesity is how much is no surgery. Starts from 3,000, and of course if you need more than one revision, right, if you need a revision, it's a little bit more, so it starts from 3,000. So for example, that person that had a BMI in 33 has an obesity stage 1. Obesity stage 1 wouldn't be a problem actually, but obesity stage 2 it will be. So for example, obesity stage 3 starts from 35. So if this lady actually gains a little bit of weight, and she is actually around 215, which is not that hard to actually gain 15 pounds, we're going to be in 36. That is actually an obesity that you start getting comorbidities. So what's a comorbidity? So comorbidities is when you actually experience having joint pain, you start having cholesterol, you start having high blood sugar, you start having high blood pressure, you start having low sexual appetite, you start having less. Of course, your period starts getting not to be every month as every single girl. So what we start experiencing is a disease that is called actually obesity. So obesity is something that we can treat. But of course, we went over and over in these different categories of how do you take care of actual obesity, how the gastric sleeve is performed, how much is the gastric sleeve. So we're going to be speaking now about bariatric. So if you had the gastric sleeve, we're going to be speaking about what the bariatric nutrition is going to have to be. So wait 1 second. Of course, that's the first 10 days of your dieting after surgery, right? Sí, un poquito de eso vas a empezar a comer, no al ratito, hasta el día de mañana. Sometimes it's not necessary to actually go through all that vitamin thing that she's mentioning. Actually, it's really important, but the thing is that it's mainly important to keep your normal diet because everything is going to be absorbed. Actually, the gastric sleeve is not a malabsorption procedure. It only restricts what you eat. Listen, listen, listen. That's true. In this case, we're speaking about the gastric sleeve post-surgical nutrition. And of course, everybody's going to be recommending you different things. For example, she's recommending a bunch of medications after. For example, calcium, vitamin B12, and I do agree it's really important. But you can always have it, of course, in your normal diet. So, if, of course, if you add, for example, regular things such as soy, such as actual milk, do you expose yourself to the sun? Because everybody has vitamin D deficiencies. Less, I don't have it because I live in the beach. Okay, let me talk about it because I think differently. Okay, omeprazole, she says 20 milligrams once a day, 2 months. I would say pantoprazole, which pantoprazole is a smaller one. You can actually have one. It's 40 milligrams. You take it once a day for a month. If you behave good, you're gonna be alright. There is actually gallbladder problems. She's saying on a medication that we don't use, but of course, if you want to check out, you can get an ultrasound, and you can definitely know if you're able to do that gallbladder removal at the same time, which you can actually do. Which surgeries could combine with actual the sleeve, the gallbladder removal, hernia repairs, and sometimes some kind of like menstrual things. There is somebody that asked me, I'm 150 and I measure 5'3". Your BMI is 26.6. Of course, you're not a candidate. Yes. Latina, ¿cómo estás? Cuando gustes. Okay, well, thank you that everybody that actually watched it. I know that there is a lady that is having surgery today and she's here in live. We're so happy. Can we talk to you? Okay, are you here already? Hello, are you here already? Are you still here? That you having surgery today with us? Dice, doctor, a ver si algún día se me hace hacer una operación con ustedes. Claro que sí, vas a ver que sí. We're always going to get it, of course. We always have the chances. So, of course, thank you so much, everybody that watched out live. This time it was pure speaking about the aftercare after the gastric sleeve. So, what we're going to be doing now is that we're going to be speaking about different kind of subjects. But of course, it was a pleasure to talk to you. We'll see you guys soon. Sandy, thank you so much for watching. Christina, thank you so much for watching. Katie, thank you so much for watching. Everybody, thank you so much. It's been a pleasure. And look at this beautiful view. Remember, your life could be the one that you always wished, but it's not easy. It takes a long time. Don't get discouraged. Just take your time. See you soon.